Please follow these simple steps for the first 10 days after your surgery to ensure your comfort and the best result for your hair transplant procedure. The two most important principles for good aftercare are to avoid any contact with your grafts until the 6th post-operative day, and also to keep your grafts moist using the post-operative healing spray. Let's take a look at the various aspects of aftercare in more detail. Swelling. If you've had treatment in the frontal scalp, you may experience swelling of your forehead and between the eyes. This is completely normal and tends to peak around the 3rd post-operative day. Swelling can be managed by massaging your forehead outwards and down around the eyes and by applying ice packs to the forehead for 10 minutes, 3 or 4 times a day. Be careful to avoid contact with your new grafts. Swelling can be minimized by avoiding bending over and keeping your head above your heart for the first week after surgery. Sleep. To reduce swelling, sleep at a 45-degree angle for the first 3 days after surgery. Use a neck pillow or rolled up towel to hold your head in a safe position to protect your new grafts from contact. You will be provided with absorbent pads to cover your pillow. By the 6th post-operative day, the grafts are secure and you can now sleep with a normal pillow. Graft care. It is crucial that you avoid contact with your new grafts until day 6. At this point, the grafts will be secure, and it's normal to then see the transplanted hair begin to shed. Please use the aftercare spray every 30 minutes throughout the day and every 2 hours during the first 2 nights. The half-hourly daytime sprays should be continued until the bottles are empty. This usually takes around 2 to 4 days. The spray will keep the grafts moist, reduce scabbing, and most importantly, provide energy to improve healing and graft survival. Donor care. On the evening after your surgery, it is important that you remove any dressings or headband before you go to sleep. You can reduce scabbing and improve healing in the donor area by applying moisturizing ointment at least twice a day. Please note that the ointment is only to be applied to the donor area at the back and sides of your head, not to your grafts. You can stop applying ointment on the 7th day. A good moisturizing routine should ensure that the donor area looks clean and free of scabs by day 10. Hair washing. You are not required to wash your hair for the first 24 hours after surgery. On the 2nd to 5th days after surgery, you may wash your hair by pouring cups of very diluted shampoo and water over your grafts and donor area. We recommend mixing just a drop of baby shampoo provided into a large bowl of warm water, pouring several cups of this mixture over your head and then rinsing with several cups of plain water. Your hair still shouldn't be touched at this stage, so should be left to drip dry. On the 6th day after surgery, you can touch your grafts. This is an opportunity to start gently removing any scabs and dry skin from your grafts and from the donor area. We suggest that you wet your hair under the shower and then generously applying conditioner to your whole scalp in order to moisturize any scabs. After 10 minutes, you can gently massage off the conditioner under the shower and then wash with baby shampoo as normal. If you gradually increase your fingertip pressure over the next few days, you should be free of scabs and dry skin by day 10 to 12. After this point, you can wash your hair normally. Remember that it is normal to see some of the grafted hairs shed during washing and that most of your new hairs will shed during the first 1 to 6 weeks. Medication. We will provide you with painkiller tablets to ensure that the days after surgery are comfortable. However, many patients find that they don't require painkillers within a day or so after the procedure. We may also suggest that you take a course of antibiotics during the post-operative period. Doctor will explain these prescribed medications in more detail. Here's some lifestyle advice. Exercise. We ask you to refrain from exercise for the first week after surgery while the grafts are becoming secure. Swimming is best avoided for 3 weeks after surgery. Diet. To prevent bleeding during the first 2 days after surgery, we suggest that you avoid food and drink that can flush the face or thin the blood. So during the first 2 post-operative days, please avoid caffeine, alcohol, spicy foods, garlic, and multivitamins. Hairstyling. No attempt at hairstyling should be made during the first 5 post-operative days while the grafts are bedding in. For the first 2 weeks after surgery, please avoid any styling products containing alcohol and refrain from applying concealer or thinning fibers. We ask that you wait for 4 weeks before any harsh treatments such as hair straightening or coloring. Sun. Please avoid exposing your treated area to the sun for the first 3 months after surgery. If you're out in the sun for more than 5 minutes, it's best to wear a hat or apply high-factor sunblock.